Hello, my name is Poretski, and together with my research partners Taabassum and Professor Anthony Tang from University of Toronto, I'm happy to present our research in progress on immigrant families' health-related information behaviors on the instant messaging platforms. We define information behaviors as activities related to sharing, consuming, discussing information. By health-related information, we mean the information coming from official sources online, news, governmental recommendations, and reviews in the context of health-related topics. We specifically focus on the information behaviors of the families with the immigrant background, enacted on their family groups in instant messaging platforms such as WhatsApp or WeChat. We base our preliminary findings on the analysis of in-depth interviews with 6 participants from different immigration backgrounds. Here's what we found. Most importantly, love and care for other family members motivated all sharing behaviors. The participants chose to share or even withhold information based on their assessment of how it will emotionally affect their loved ones. For example, consider this quote. I found this information very interesting, but I did not send it to my parents because I thought that it would create panic. No less importantly, the immigrant background created the particular preference to the messages that were written on users' native language and were consistent with the belief frameworks and traditions of their native culture. This is how one of the participants described her mother's preferences. It's my mother who decides on anything related to health. So whatever she says goes because she would pull up some articles in Chinese as evidence. An additional quote describes how the participants engaged with native culture consistent information even when her formal health-related education may have informed her otherwise. No less important, the participants engaged with the information on a quite surface level. They often shared only links to the information instead of the content itself. They engaged more with the basic content, preferring clear, simple message to verifiability and scientific consistency. The messages that have been disseminated over and over on the web were often picked up and disseminated into the family group. Finally, the participants strived to avoid conflicts and thus did not debate contradictory information in their family groups. As one of the participants said, I usually say thanks for sharing and drop it. This is strikingly different from how the participants usually behaved in face-to-face live conversations, where the debates over inconsistent information were quite welcome. As one of the participants said, the reason to share such information is so that the conversation can happen around it. It's also different from the general social network communication dynamics where multiple conflicts can emerge around any information piece. To summarize, we found that love and care informed all information behaviors of the participants. They also preferred the message that was consistent with their beliefs and values of their original culture. They engaged with the information only at a surface level, and when the information was inconsistent with the family members' beliefs, they avoided discussing or debating it out of fear of conflicts and tensions. Our findings allow us to describe immigrant families as being increasingly resilient to the internal conflicts, where the families were conscious about multiplicity of their beliefs and tolerant to other cultural preferences, and thus avoided conflicts. On the other hand, information acceptance and avoidance of debates led to the increasing risk of misinformation spread within such family groups. Please read our paper for more details and discussion.